So today we have Mr. Sampson who came into the ED presenting with severe right knee leg pain for the past 3 days. And first I'm going to do a quick Q-sin on Mr. Sampson. I'm going to check his wristband, make sure his name and date of birth are on it. I would check the whiteboard to make sure it's updated with the correct staff. And he has no oxygen on. No NG tube, no chest tube, no abdominal tubes. He does not have a Foley catheter, and he has no IVs in at this moment. His bed is in the lowest position. He has 3 side rails up. He has this call light within reach. He's got water, and then there's no obstacles around his bed in the way of getting him to the bathroom or making him a fall risk. So now I'm going to do a head-to-toe assessment on him. Hi, Mr. Sampson. My name is Grace. I'm going to be your nurse today, and I'm going to do a quick head-to-toe assessment on you. First, I'm going to wash my hands, apply some gloves. So can you tell me your name and date of birth? Okay, and you know where we're at today? Okay, and then do you know the date today and time? Okay, so he's alert and oriented ×3. I'm going to take his vitals. I'm going to do a quick temperature. Can you open your mouth for me? Thank you. Okay, it is 101, which is slightly elevated. And I'm going to check his pulse bilaterally. His pulse rate is 86. It's strong and regular. And I'm going to check his respiratory rate. And it is 16. And it is regular and normal ventilation depth. I'm going to check his blood pressure of his right arm. And it is 132/84. And I'm going to check his pulse ox, and it is 97% on room air. So I'm going to, can you squeeze my fingers for me? Thank you. Can you push against my hands? And can you pull back? Okay. His skin is pink, warm, and dry up top here. In his fingers, he has some swollen nodules that are red and warm to the touch. And I'm going to check cap refill. It's less than 3 seconds. Do you have any numbness, tingling, or pain in your fingers? Okay. Can you wiggle your fingers for me? And are you having any pain anywhere? In your right knee? Okay. So, can you rate it out of a scale of 0 to 10? An 8 out of 10? Okay. And it is like a shooting pain, stabbing pain. Can you describe the pain for me? Okay. Is there anything that makes it better? Not walking on it? Okay. So his right knee is extremely warm, red, and it's swelling. So I would make sure to document that and tell the healthcare provider. So I'm going to take a listen to your lung sounds. The chest is symmetrical and lung sounds are clear. Are you having a cough at all, Mr. Sampson? No? Okay. And he is not short of breath. Now I'm going to check your apical pulse for a full minute. and is regular and strong, and S1 and S2 are present. There is no JVD noted lying down, and then I would sit him up, and JVD is not noted there either. And I'm going to check your bowel sounds now. So bowel sounds present in all 4 quadrants, and abdomen is soft and flat. Can you tell me when your last bowel movement was? Okay. Was it soft, hard? Soft. Okay. And are you passing gas and belching? Okay. And any constipation or diarrhea? No. And nausea and vomiting? No. And are you having any urinary frequency, pain, or burning when urinating? No. And are you having any urethral discharge? No. All right. So now I'm going to check out his feet. Can you push against my hands? Can you pull back? All right, I'm going to check your cap refill on your feet. Less than 3 seconds. Any numbness or tingling in your feet? No, okay. And can you move your toes for me? Okay, and can you tell me what toe I'm touching? And then there's no edema here. And so the only concerns are the nodules on his elbow and his knee. So Mr. Sampson, do you drink any alcohol? Okay. So you drink a bottle of wine, or a cup of wine a day. Okay. So I would document all that and report it to the healthcare provider. And I would leave Mr. Sampson in the bed in lowest position, 3 side rails up, his call light within reach. And I would throw in my gloves and wash my hands. And I'm now going to do a report off to the next nurse. So Mr. Sampson is a 62-year-old male who came into the ED complaining of severe right knee pain for 3 days. And he had an unsteady gait, was limping, and guarding that right leg. He stated he had a history of Hep C and HIV, and he drinks a glass of wine every day. With further assessment, his right knee was swollen, reddened, warm, and tender to touch. He stated his joints swell up like this all the time. He had a swollen nodule on his left wrist and 2 nodules on his knuckle of his right hand. An x-ray was performed on his right knee and his hands and showed crystal deposits around the swollen joints, and his blood panel showed an increased uric acid level. He has been on anti-inflammatory treatment because he was then diagnosed with gout for the past 2 days, and he is seeing PT. His joint swelling has decreased significantly, and he is able to walk easily without pain, and he is set to be discharged today. And he's going to be taught on avoiding alcohol, a low purine diet, and the importance of the medications taken as prescribed and the side effects for it, and how to increase his fluid intake throughout the day.